Okay, well, today we are going to talk about micronutrients. So I'll be sharing my screen with you. We're just going to go through a few things and talk about the most deficient micronutrients we're going to run across. So if anybody has any questions, they can pop it up in the chat or whatever, and this can be interactive. If not, well, hopefully you learned something. So anyway, with micronutrients right off the bat in the USA, we're talking like there's 31% of the people in the United States are at risk of having at least one vitamin deficiency or anemia. And I know this because my daughter had anemia, and I see a lot of patients with anemia, and they get tired, weak, they don't feel right, but yet they don't know, and it's anemia until they go and get their blood work done a lot of the times. But anyway, 31% of the people in the United States are at risk for at least one vitamin deficiency. Next, 23% for two, and then 6.3 for 3 to 5 vitamins being deficient in. So we'll go through some of the most common ones that people are deficient in, and we'll kind of educate you on the signs and symptoms of those and go from there. So, the most common ones most Americans are deficient in the diet is vitamin D, is one of them. And with vitamin D, it plays a critical role in strengthening the bones, the muscles, and it acts as a protective agent against cancer and diabetes. Okay. So, and how do you get it? You get it through like sunlight, food. Some of the things that have it are fish liver oils, fatty fish, eggs, liver, mushrooms, milk, yogurt, things like that. So vitamin D is one of the most common ones. Next is folic acid. Folic acid is B9, and that's what you have to maintain a pregnancy. People had those if they were like when they went to the doctor, their OBGYN, they were told, hey, make sure you get enough folic acid so the baby doesn't have cleft palate or spina bifida. And so it's real important that you get that. Again, folic acid is B9. And one of the problems with folic acid is people have a problem converting folic acid to methylated folate. So methylated folate is the active form, folic acid is the inactive form. And so when you go buy vitamins, I'll show you this later when I show you the vitamins, just the recommendations. Just remember that if you buy a vitamin that has folic acid and you're not a good methylator, because everybody's talking about methylation, it just means you won't be able to convert it to methylated folate, and that's a cheap vitamin. So you don't want to get your vitamin B9 or methylated folate. You've got to get methylated folate. You can't get folic acid and turn it to if you can't turn it to methylated folate, it's not going to be any good for you. Okay. Another one is vitamin B6. That's another one that people are deficient in. And that's going to, you're going to see that, especially in younger people. And you can get that in chicken, fish, chickpeas, bananas, things like that. So that's another common one is vitamin B6. And then one of the other ones that I see a lot of is vitamin B12, and it's cyanocobalamin. So what we want is we want methyl cyanocobalamin. Again, if you can't convert it to a methyl form of B12, you won't do very well. So you need vitamin B12 for your red blood cells. You need it it can help with depression. It can help with, you're going to have weird feeling like sensations in your hands or your feet, your limbs. And it's big for people who have like MS or Parkinson's, nerve conditions like that. And it's good for energy. So these are the most common ones are your vitamin D, folic acid, which is B9, vitamin B6, and vitamin B12. So we'll go through that. And then here's what I would tell you is when you do go to the doctor to get tested, I just picked these. Here's B6 right here. Sorry about the squiggly. Here's B12, here's vitamin D, and here's folate B9. So we're just going to run through these. Now in B6, we look at what's extracellular, what's in the blood. This is the blood, and intracellular, what's in the cell. Okay. So if they just look at what's 9 times out of 10, they won't even look at what's in the blood on these. But if they do, that does not mean that it's getting in the cell. So I'll show you what that test look like so you have a pretty good idea. So on vitamin B6, you look at in the blood and you go, okay, is it getting into the cell? If it's getting into the cell, we're good. Same thing with B12. Now, vitamin D, we don't have to check it in the cell because we know it's in the blood, it's good. But then when we go to folate B9, we want to make sure it's in the serum. But then this one's a little different. It goes into the red blood cell. Remember we talked about red blood cell? And so this is real important that it gets into the red blood cell. So we want to make sure it's getting into the right cell. And then here's what this test looked like. So again, here's the serum. So this person has plenty of folate, B9. This is B9. So this person has plenty of it. And in the cell, again, they have plenty. So I would assume this person is probably taking some good B vitamins. And again, this is B9. B12, they're not that great. They're okay. Here they are. So this person in the serum, they're showing up in the normal, but I would like to see them higher. I'd like to see them up in this range, higher in the serum and in the blood. But they're there. If they're really low, that's not good. And then we can go look at B6. Let's look at B6 serum. This person's on the lower end. We could get it higher. And cellular. But they're okay. They're not so low that they're going to have symptoms, but they are low enough where they might want to supplement. And then B12, we're looking here at 42. They're going to say is normal. I like to see them a little higher than that. So I would say let's try to get to at least 70. Okay. Now, this is where it gets tricky because if you go into the doctor and you get your vitamin B12, your vitamin D levels checked, they're going to say 42 is okay. But most people, 42 is not good. And here's why. Because it's your immune system, it's autoimmunity, it's it's inflammation, it's everything. So you want these levels to be up around 70 to 100. That would be a good mark if you could get your vitamin D levels up 70 to 100. I try to keep mine up pretty high. So this test not only tells us what's in the serum, it tells us what's in the cell if we need that, okay? And most doctors are not going to check this. So then again, let's go here and let's look at, what are the four most common vitamin deficiencies? Vitamin D, B6, B12, and folic acid, B9. So that's why I picked these. So we can go through these. Now, if we look at B6, what are the symptoms of B6? Skin rashes, cracked or sore lips, glossitis, so inflamed tongue, basically, increased feelings of anxiety, depression, irritability. Okay. So fatigue, low energy, weakened immune system, pain or tingling in the hands and feet, and seizures. So if you're thinking B6, a lot of people don't talk about B6, but I'm telling you that if they're low in B6, it's going to be a problem. And so these are going to be some of the symptoms. Ones that stand out to me are really fatigue, a weakened immune system, and I would say probably the pain and tingling in the hands and the feet. Someone's going to go to the doctor for that, and they're going to say, oh, you got restless leg syndrome or something. Okay, well, but did they check for a vitamin B6 deficiency? Okay, and there's other vitamins too. So this is the most common symptoms for vitamin B6. So then let's look at B9, which is folate. This is a really important one too. And those who are bad methylators cannot convert folic acid to the methylated folate that we need to. So what are the symptoms of folate deficiency in women? I was real specific on this one in women. Extreme tiredness, so fatigue, paleness, shortness of breath, irritability, dizziness, tender red tongue, mouth sores, so everything's going to the mouth. You see that? Reduced sense of taste, memory loss, difficulty concentrating, and confusion. So when people start to get older, they don't absorb these vitamins like they used to. So they probably need to take a little bit more. So if anyone, is a senior, I would say anyone over the age of 65 definitely probably needs to supplement with these. And they're probably not. They're probably on a lot of medication, to be honest. I had a lady in today and she was on 10 different medications and she was feeling horrible. So at the end of the day, I don't even know how to address that. I told her we need to work with her doctor and try to get her off some of those medications and start supplementing because she has all these symptoms. But she's went the medical route, which is fine if that's what you want to do. But that's not what I'm trying to do here. Vitamin B12 deficiency in adults. Again, look at some of these symptoms. fatigue, headaches, depression, pale or yellow skin, mental impairment, pain and inflammation in the mouth and tongue, pins and needles in the hands and feet, and oral problems. So again, look at these B vitamins. Everybody's showing up with these symptoms. So if you happen to have depression or fatigue or headaches, you're going to go to the doctor and they're probably going to put you on meds, but nobody looked at your B12 levels. And if we go back here, let's go back here. Let's look at this person's B12 levels right here. We could look and say, oh, are they in the normal range here or are they really low? If they're low, that's not good. They're going to have those symptoms. So we got to be careful with that. So, and 9 times out of 10, guys, most doctors are not even going to look at these serum levels. That's just your blood. You really got to look at both, especially if someone's not getting better and they're on a bunch of medication and they just, they're struggling. So you got to know that. So again, that's B12. I see a lot of B12 deficiency. And the other thing is a lot of people who have gut issues or like multiple sclerosis will have B12 issues. This is good for the myelin sheath on your nerves. And then let's go to our last one, vitamin D. So here's what you get with vitamin D deficiency. Again, look, fatigue keeps popping up. Now it gets better. This is like you get that bone pain, you get that deep pain, muscle weakness and aches and cramps, mood changes. They're going to lean more towards depression. They're going to have problems sleeping. They're going to get sick often because their immune system's down, anxiety, slower wound healing. Things are just not healing like they used to. They'll start to get twitches and tremors and spasms, joint stiffness, and arthralgia. So again, what I see here is a lot of people here I see having rheumatoid arthritis or chronic fatigue syndrome or fibromyalgia. So start thinking that. Think about vitamin D and what's it going to hurt? I mean, it's not going to hurt much to supplement. And I'll show you what we look at in supplements, just so you have an idea. So here, people who should take the B vitamins. Okay, so I just picked on B vitamins, but basically, definitely pregnant women, you got to be taking it. Vegans or vegetarians, because they're not getting the B vitamins. People with gastric bypass. I had a lady who had a gastric bypass. She's not absorbing things very well. So definitely B vitamins there. Older individuals we talked about, because they don't, their appetite decreases, but they just don't absorb things like they used to. And then, people with, I would say anyone growing, especially kids or pregnant women, you got to have a lot of the B vitamins. And like I said, B vitamins are just, they're water soluble. So you need to almost take them every day if you're not getting them from your diet. They're water soluble vitamins. They're going to be in and out of your system. So if someone were to have, we picked on B6, B9, and B12. So here's the product that I would suggest for this, just because we're going to hit them all. That's how good these guys are who do the products for me. They've got B6 here. Look how much they have in there. 2 milligrams, 118%. They got folate. So here's what you want to look at, folate. You want the L-methylfolate. You do not want the folic acid. And look how much we have in here. We have a ton of it in here. And then we want B12. We want the methylcobalamin, not the cyanocobalamin. Cyanocobalamin is cyanide, okay? We want vitamin B12. We want methylcobalamin, okay? And it's giving you a ton here. And this is going to be for mood improvement and stabilization, mental focus and memory improvement, healthy sleep cycles, better hormone regulation, and enhanced glutathione production. And glutathione is what's going to kill free radicals. Okay. Glutathione is what's the anti-aging. Nobody, and I bet most people don't even know what glutathione is. I know I didn't, but it is going to come in and it's going to get rid of the free radicals, and it's going to it basically detoxes you. But glutathione is your best free radical killer. And guess what? As we age, we have less of it. We don't make a whole lot of it. Okay. So you're going to need that. So if you got your B vitamins, you're going to be okay. Now, let's look at vitamin D. One of the things we look at vitamin D, what's vitamin D? Well, we want D3. We give it with zinc, boron, and K2. Now, what this does is it helps grab the calcium out of the vessel and put it in the bone where it belongs. So women suffer from the number one reason for women to die is cardiovascular disease. So we definitely want to pull the calcium out of the vessels and put it in the bone. And then we also want those bones to be strong. My mother-in-law recently broke her shoulder and had to have a shoulder replacement. Well, guess what? She has osteoporosis. She doesn't supplement, probably doesn't get enough vitamin D, let alone get it with K2 and calcium to get it into the bone. And she's struggling with that. But if her her humerus just shattered when she fell. She fell on concrete, just shattered. You do not want that. They had to do a total shoulder replacement on her, where if she would have, her calcium levels would have been up and she'd have been taking vitamin D with K2, maybe it just would have broken one place and they could have just put it in a cast and she could have recovered. But she didn't. So, and vitamin D is just good for your immune system. It's good for inflammation. So it's going to improve inflammation control, healthy blood circulation, enhanced bone health and proper calcium storage, like we talked about, improved cardiovascular health and calcium delivery, and improved immune function. So that's why I'm saying when we look at these things, we want to test these, and these are things that you could ask your doctor to test for. And if not, you just need to get with a good functional medicine doctor. Now, these are just the vitamins I picked, but there are other things we can pick. Like here, we can look at antioxidants, we can look at metabolite. I mean, we can look at a lot of things, guys. It just really boils down to when I do a health assessment with someone, finding out where their problem is, and then just getting the right tests so we get the right information, and then we can individualize it. So what we do is we do it, we assess, then we test, and then we personalize. So, and I do offer health assessments for those who are interested. So if this sounds like something you'd want to know, you can definitely reach out to us for a health assessment. And if anybody's got any comments or anything, that's fine. We can chat. If not, just let me know if there's something you want me to talk about in the future. I'd love to talk about it. But again, we offer health assessments, and this is just one of the tests. This is a micronutrient test I run on people, and it tells me everything I need to know about the micronutrients. If you look at this, it's telling us, is it in the cell? Is it in the blood? Antioxidants. You want to look at these. This is for people with bad antioxidants or low, typically have cardiovascular issues. Here's your minerals, calcium. Do you have enough calcium? I mean, here's your amino acids. If you don't have those, amino acids builds proteins, and proteins is your hair, your skin, your nails, your neurotransmitters, your hormones. It's everything. So if these guys aren't there, then you're in trouble. And then, we also look at fatty acids. This is what people with cardiovascular disease come in. These are all messed up on them. So we can really look wherever we need to look. And that's the beautiful thing about functional medicine. I just love it that you got to find the root cause. Again, you got to assess, you got to test, and then you personalize. So everybody's different. Okay. And this is not something that your typical primary care physician is going to learn. Um, it's just not in their wheelhouse. They're not trained in it. I wasn't trained in it. You have to go off and learn this stuff on your own. So anyway, that's why I love functional medicine, because you can really get in there and find the root cause. So just let me know if anyone's interested in doing that with us. Just reach out to us, hit the link below. We'll send this out, and you hit the link below and get a hold of us. But other than that, I hope you guys learned something, and we'll bring you something next week. Okay. Thanks a lot, guys.